Let's practice an NCLEX-style question, shall we? The nurse is caring for a client who has a sodium level of 149 milliequivalents per liter. The nurse anticipates that this client would benefit from which therapy? Here's the answer choices. 1. Cough suppressant. 2. 3% saline solution. 3. 5% dextrose in water solution. Or 4. Lactulose. You don't need any gimmicky test-taking strategies to figure this out. You just need to know how to think like a nurse. If you need some help learning how to walk through questions the way I'm about to walk through it with you, then go over to the link in my profile and sign up for my free Silver Bullet study system training. You won't regret it. The key to answering these kind of questions is to take the information that's in the question, pull out the information we know we need to have in our head, combine the two, and figure out what's the missing piece, and that's our answer choice. Now, immediately in the question, we see that their sodium level is 149, which we should be able to pull out of our head what the normal range for sodium is, and most people say it's about 135 to 145. So they've got a bit of hypernatremia here. That's normal step 1 information that you should have learned if you're following the Silver Bullet study system. So if we think through the 4 steps, what they're asking us is, what does the nurse anticipates going to happen next? What kind of therapy are they going to get? That's step 4 of the Silver Bullet study system. So we have step 1, we use that to identify step 2, which is what's broken. We have the hypernatremia, and we have step 4, which is what we need to identify. Step 4 often relates to dealing with the symptoms of something or trying to correct the root cause. And just scanning the answer choices, I think we're going to be trying to correct the root cause here. We need to deal with that high sodium. So we already have a hypothesis that we're going into these answer choices looking for something that's going to help us reduce the sodium. Let's evaluate each answer choice. Number 1, cough suppressant. What's that have to do with sodium? And nothing that I can think of, obviously. Number 2, 3% saline solution. This is a hypertonic solution, which means it has a lot more stuff and a lot more sodium. So this would be adding to the problem, not improving the problem. Number 3 is 5% dextrose in water solution. Now, this is technically an isotonic solution. And you might be correctly thinking that we'd rather give a hypotonic solution for high sodium levels because we want to give them more water than additional electrolytes. But the thing about dextrose is it's really unique as an IV solution because the dextrose is going to get sucked into the cells with the help of the insulin almost as soon as it hits the bloodstream, which means you're going to be left with water in the veins. So even though this is technically an isotonic solution, it acts hypotonic once it's inside the body. And that's exactly what we want in this situation because that extra water is going to dilute the sodium that's present with our hypernatremia. So this seems like a really solid answer, but let's check number 4 just to be sure. Lactulose is something we'd give for constipation. That makes number 3 our answer. Check out my IV solution playlist to learn more about dextrose solutions and get your free Silver Bullet study system training in my bio link so that you can think this way for yourself on NCLEX-style questions.